The people who have done so much for us, and to think about what they mean to us. And I had an experience this week. I have an aunt, my Aunt Jean. She lives up in Maine. She's 93 years old. And she reached out to me because she saw one of these morning press conferences. And she was very taken with the use of the word boomerang to describe the fact that we have to fight this disease and make sure her family went through, our family went through in the Depression, how they overcame it, how they survived it. She's told me stories about my dad when he was in the U.S. Army in World War II, the letters she would get when he was fighting in battles all over the Pacific, the letters that would come that would tell her that he was still alive and what that felt like. And it gives you a sense of what we have gone through, but it also gives me a sense of gratitude. When I talk to my aunt, I feel just such gratitude for her. I feel such a sense of inspiration that, you know, she's still here and that she still has this wonderful spirit and love of life. And I think every one of us has people like that in our life. And it's a reminder that we literally wouldn't be here without all of them, but also of what they've taught us, what they mean to us. It's a society that in many ways prizes what they mean to us and what we owe to them. What we owe to them in terms of making sure they are healthy, making sure they are safe, always being there for them. Now, this crisis has clearly been so tough on the oldest New Yorkers. And it has shown us once again that we have to redouble our efforts to help those who are most vulnerable. And some of the folks who have had the toughest time are seniors who live in nursing homes. But I think about what it's been like in these last few months in the nursing homes of our city, what it has felt for seniors. The fear that we all feel, I'm sure, has been magnified for so many of them. The sense of isolation that all of us are feeling has been magnified for so many seniors. We all have more to do. And I know the state of New York has been working hard to address this issue, and the city has as well, but we want to keep doing more and more. So today I want to talk about that had to go to save lives in hospitals, had to go to protect the healthcare workers and first responders who are the people saving our lives. We're now spreading out testing throughout communities. Thank God we're getting more and more of it finally. No thanks to the federal government. I wish they were doing more. They still need to do more, but we are making real progress in the amount of testing. So starting next week, we will offer PCR tests, the diagnostic tests, to every nursing home in New York City. This will be for on-site testing in the nursing homes, tests a day. And we want them. We want all the nursing homes. Again, we don't control them. There's a few that are in the domain of our public health system, but the vast majority are private, nonprofit that we don't control, we don't regulate. But we're offering this to all for free. And the test deliveries begin next week. We'll ramp it up immediately and then continue as long as it takes. If it takes, as long as we're fighting this crisis. And for a lot of them, this has been a very, very tough time, you can imagine. So again, I always say, I want to offer my thanks, but please, if you know anyone who works with our seniors, if you know anyone who works in a nursing home, thank them, because they deserve that support and encouragement. Well, when the testing grows and grows, of course you'll find some of those good people will test positive, because more and more people around New York City will be identified as positive, including people who didn't even know they had the disease. Anyone who tests positive, works in a nursing home, has to stay away for 14 days. You're going to a nursing home. By the end of next week, every outstanding staffing request from every nursing home in New York City will be fulfilled by the City of New York. Part 3, outbreak response teams. So the goal here, of course, is to keep containing the coronavirus, keep pushing it back. But wherever we see an outbreak, even if it's as localized as happening in a single nursing home, we want to go right at it. We want to act immediately. So we have 10 outbreak response teams ready. So the second there's any sign of a problem, this team can go in, can oversee the response, can help control infections, make sure the PPEs are where they need to be and the supply is right and people are using them the right way, make sure that retesting is done in the facility, that everything is handled so that the outbreak is contained and people can move forward safely. And then part 4 is looking ahead to the future. Look, the future might look very different, and I think we need this city towards much more focus on helping our seniors to stay home and have all the supports they need. That's a big effort. It's not something I can tell you we can do today, but it will be part of our recovery planning. We have said we're not just going to bring the city back, we're going to bring it back stronger, better, and fairer. We're going to address a lot of things that didn't go addressed before. This is one of them. So as part of our recovery process, we're going to look at how to maximize home-based care rather than nursing home care so we can support our seniors better. Of the different types of hospitals, everyone who was at the front line needed protection. That meant the personal protective equipment, the PPEs. And we know it was a fight from day one. And again, when we look back on the history of this, the scarcity that attended to this crisis from the first minute that we're still fighting against now was shocking in this land of plenty. But I want to thank all the people in all of the agencies, in the hospitals, every day. And I am talking down to, I would talk to the team and they would be pursuing individual leads with individual companies in countries all over the world, constantly trying to see, could we get a shipment one day earlier? And then, as we've talked about before, realizing we had to protect ourselves by maximizing production here in New York City. And that's a wonderful, valiant story. And all the people who are doing that work, producing PPEs here in New York City, they are heroes. And I want us to remember that and really appreciate them in the months and years ahead. Is the real world reality of scarcity that we had to deal with. But now I can say something I rarely got to say in the last few months. We are confident about the supply we have for the remainder of the month of May. That means the N95s, the face shields, the goggles, the gloves, the surgical gowns, the face masks, meaning the surgical masks. All of those items are now in sufficient supply to get us through the month of May to protect our first responders and our healthcare heroes. And of course, FDNY, NYPD, correction, all of the agencies that need the PPEs, we're providing for them, and any of the other key agencies that have PPE needs. So that's something I can say with some relief that we'll get through this month. We still have work to do to increase that supply for the weeks and months ahead. And then to build out what is thrown at us in the future. And we'll have the ability to build right here in New York City what we need. If we ever find that the supplies we depended on are failing us, we'll be able to go into high gear in this city and cover a lot of that gap right here. Okay, now I want to bring up a new topic today. In every crisis, new issues emerge. We don't even understand yet the full magnitude of the crisis we're living through right now. As I said, greatest healthcare. Right now, the issue is vaccinations. Not the vaccine we hope for with the coronavirus, just the everyday vaccinations that kids get to keep them safe. The vaccination rate in this city this is striking. The vaccination rate in this city has been falling during this crisis. And the sheer magnitude of it has become clear to us in the last few days. The reasons are obvious. Doctors' offices have been closed in so many cases. Families are staying 23rd when this crisis had really gone into high gear to May 9th. So about 6 weeks. Compared that period of time this year to the same period last year, and what we found was quite shocking and troubling. The number of vaccine doses administered over that period this year versus last year, for kids in the category 2 years old or younger, there's been a 42% drop in the number of vaccinations to address this. And we intend to work with parents and families to do that right now. And let me explain why. The vaccines that, for example, prevent respiratory illnesses in our kids, prevent a disease like pneumonia, that is important anytime. We never want to see our child, or any one of our children in danger. We never want to see a child threatened by respiratory disease any year. We never want to see a child get pneumonia any year, vulnerable to the effect of COVID. And we're all watching this very troubling new syndrome, MIS-C. We don't want to see any child contract COVID. So the pieces, unfortunately, start to fit together in a way that should cause parents real concern. An unvaccinated child at greater threat of contracting a disease that could then put them at greater threat of contracting COVID. On top of that, that combination is dangerous in and of itself. Also brings up the link between COVID and MIS-C. We don't want to see. This is essential work. Getting your child vaccinated is essential work. Getting your child vaccinated is a reason to leave your home. And whatever it takes to get your child to that vaccination, it's worth it. So we also have to remember this is for your child and it's for everyone, because once one child gets sick, it can spread to the next child. So we have to make sure we get ahead of this. You do not need to go to a hospital facility to get a vaccination for your child. So that's the number for NYC. Again, 844-NYC-4NYC. Call, make an appointment right away. Or if you have your own doctor that you can get it done with, that's great too. But let's protect our kids and protect each other by making sure all our children are vaccinated. Okay. Now, I want to bring up a topic that isn't about the coronavirus crisis per se. It didn't come from the coronavirus. Attention to the nation's largest city, the epicenter of the crisis, and help us with a stimulus that'll put us back on our feet. Part of why our voices are heard is the representation we send to Congress. That's based on the census. The census says how many members of Congress you get. The census says how much federal funding you get. The census, if it's truly accurate, will give you the level of funding and representation you deserve. If it's not accurate, you literally can lose a member of the Congress. You can lose billions, many billions, $50 billion. That's the pool that we want our fair share of. And that means funding for hospitals. That means money for food assistance. We all are talking about food lately. That money is federal money in so many cases. Food stamps and SNAP benefits. Money that goes to infrastructure, to schools, to transportation, mass transit. So many things revolve around that federal funding that we depend on in this city. So let's talk about where we stand on the census right now. Today in New York City, our census effort, they've done amazing, amazing work. And we have so many wonderful community partners, elected officials, so many people have weighed in and become a part of this effort. But we all have to do a lot more. And time's a wasting. So if you want to make sure that we recover from this crisis and we are well represented in Washington and we have the resources we need, not just this year or next year, but for the whole decade ahead, let's make sure you fill out the census. It takes only a few minutes. There are no questions about immigration, and let's get the help we deserve from Washington. Okay, now we're going to do our daily indicators. So, day that's not perfect, but is a good day. 2 out of 3 moving in the right direction, and the one that has gone in the wrong direction is just by a little. So it's a good day. We want to have great days, though. What do we have? Well, indicator 1, daily number of people admitted to hospitals for suspected COVID-19. It went up, but just by a little, from 57 to 63. That is really encouraging to see, especially against the backdrop where we're doing more and more testing and getting a better and better look at what's happening to so many New Yorkers. We're now at 20,000 tests a day and growing rapidly, but the percentages are coming back better. So that's wonderful. Okay, few words in Spanish. Gracias a los neoyorquinos. Vamos a tomar la ofensiva en esta batalla y apoyar a nuestros más salvando vidas. With that, we turn to our colleagues in the media. And please let me know the name and outlet of each journalist.
Hi all, just a reminder that we have Health Commissioner Dr. Barbeau, President and CEO of Health and Hospitals, Dr. Katz, Senior Advisor, Dr. Varma, and NYC 2020 Census Field Director, Daniel, on the phone. With that, I will start with Mark Morales from CNN.
Hey everybody, how you doing today?
Good, Mark, how you doing?
Doing okay. I had a couple of questions I wanted to ask. First was, I know you mentioned a few weeks back about a 4th of July and any...
Amazing throughout this crisis. The folks from Roadrunners have put on these extraordinary, virtual, I think they did a virtual half marathon the other day, amazing things they've come up with. The marathon itself is obviously a ways off, so we're talking to them, but it's too early to come to any conclusions. But they are right at the table with us as we consider what to do. The resurgence of this disease. So we'll have more to say on the marathon later. On the 4th of July, what I've said from the beginning, we're going ahead with a celebration of the 4th of July. It will involve fireworks, it will involve Macy's, and that's all we know so far. It's May, we've got time. It's all going to be about safety. We're not going to let the nation's birthday, our nation's birthday, go unrecognized. But whatever we do is going to be about safety first. It may be bigger, it may be smaller.
Thinking of the population in adult care facilities who maybe aren't technically senior citizens but need that care and are in a facility like that, perhaps because of mobility issues, they can't turn their apartment into something that's handicap accessible. So that's why they're in a place like that. Do you have any thoughts on adult care facilities, plans on shifting that away? Because they're actually, as you know, there have been a lot of deaths in those facilities as well. So just beyond the senior citizens in age, but those who need 24-hour care.
Thank you, Katie. Very good question. We have to do to make sure there's PPEs for the folks who work there and people need it, testing, all the basics that as we finally are getting the kind of supply we need, we should apply regularly. But I think the question in every individual case is, can someone live independently? Is there a kind of support we can put in place that would make that work? If there is, I think increasingly that should be the preference in our society, more than it has been in the past. I mean, look, we're asking the question, at least with seniors, and again, maybe some folks in the adult care facilities, but I'm going to leave it to the doctors to speak to that.
Elderly people and younger disabled people to live independently. I've seen too often as a physician in the hospital or in the clinic where people are sent to skilled nursing facilities or adult care facilities because no one puts in the time and the creativity. It is hard, as you say, it's not easy. And as Katie is alluding to, sometimes it requires modification of the home, sometimes it requires equipment, sometimes it requires some creative staffing. But I think the way
he mentioned living in the same home as his parents who are in their 90s. That's not by accident. He chose to make sure that and Mitch, forgive me for taking this point and adding to it a little bit, but I honor it and you so much. He chose to set it up so that his parents could live in the same building he lives in. And most nights goes out of his way to make sure that he has dinner with his parents. And I think that's a very beautiful thing. and a guy who's got so many other things he has to balance, but a connection, how can we set up a more compassionate structure that allows seniors to stay in their home and give them more support? I think that's what the future should be about. And again, as part of our recovery, we're really going to look for what it would take to build that reality to help our seniors, what it would take to do something different in this city.
Next, we have Deborah Lee from Manhattan Times and Bronx Free Press.
Hey, good morning, everyone. I wanted to follow up specifically on to be tested so as to be able to show the data that you'd say the city and state and the national agencies need as well. So what's the guidance there, particularly for those who are asymptomatic? And then we've talked about this some weeks past, but I wondered if you could revisit what interest, if any, the city has in the kind of certificates or identity cards that would indicate what people's test levels showed, what is exactly that became of that. And then finally,
prioritization, very fair question, but I think the fact is there's obviously still prioritization in terms of the communities that have been hit hardest, which is where we've concentrated the vast majority of our community-based testing, and what we've said about folks who are most vulnerable, or folks who have been exposed to the disease, or folks who are symptomatic. So there's still a priority structure in place. Let me turn first to Dr. Barbeau on the question of just clarifying that we still have a sense of prioritization that matters here. Dr. Barbeau, please jump in.
Thank you, Mr. Mayor. The prioritization schema that we have for testing includes prioritizing, obviously, those that are symptomatic, prioritizing those that have chronic underlying illnesses. We've also added prioritizing health rows. We will certainly be testing more people, and certainly as we get heavily into the testing and tracing, there will be an opportunity and an indication for testing people that may not necessarily be overtly symptomatic. So I think the main message is remains the same, meaning that if you are in these priority groups, you're symptomatic, you've been exposed to someone who's symptomatic, that we want you to get tested.
That not only do people want to know their own situation, but that it's going to be important for the connection between people and the organizations they work for to know what's going on. Certainly, as we talk to folks in the private sector, they are interested in setting up an appropriate structure for knowing what's going on with each of their employees. There are privacy concerns, there are individual rights concerns, there's a lot we got to balance in this. But from a societal point of view, we understand that people want to know if they're going, for example, that's important. If someone's had a recent coronavirus diagnostic test and it's a negative, that's important. So I like the idea of something that allows people to be able to validate and verify their status. But we've got real issues that we got to work through before we get to that. And that's something, it's a very important decision we have to come to, and we're going to obviously work with the state on it as well to strike that balance. Dr. Varma, you want to add?
Great. No, thank you very much. This is a very complex topic, one sort of scientifically making that conclusion, although it's likely that at some point, in the very near future, we'll be able to get the science behind it. But then we have the legal challenge. You would essentially be telling people who have normal immune systems but simply haven't been infected that they're ineligible to work. And I think there are some major questions in the United States regarding disability protections and other employer protections about whether that is legal. And then, of course, there's the ethics of it, which is that, again, are we incentivizing people to include, once testing capacity becomes better, frequent testing of people who are asymptomatic? In an ideal world where we had an abundance of testing, that would be the strategy we would be using. And large workplaces could use some equivalent of like a boarding pass or like a security check to allow that. But we're not really there yet, unfortunately, technology-wise. So we would really need to depend on proxy measures like symptom screening and temperature checks.
Thank you, Doctor. Okay.
Next we have...
Secondly,
I hope you got a chance to look at our cover because there's a great image of you wearing a vintage one-piece bathing suit. And I was looking for your reaction to Long Beach and Nassau County making their beaches residents only.
Julia, I regret to tell you I have not looked at the cover, but now I must say I have to, and I'll give you art criticism on it. But look, on the question of the beaches, every place has to figure out what's right for themselves. And the fact is that's what the state determined. That in counties where people are mainly going by car, where beaches don't get crowded the way ours do, if that's what works for them, I respect that. Everyone has to make their own choice, and everyone has to set their own ground rules. So, to me, I think this is more straightforward. I don't see anything but sort of the obvious reality. And I had a couple of good conversations with the Nassau County Executive, Laura Curran, who I think very highly of and very respected this lack of vaccinations we've seen, and then this development at MISC. So let me start with Dr. Barbeau, and then if Dr. Varma or Dr. Katz want to jump in, please do.
Thank you, Mr. Mayor. Let me start off by saying that as we have said before, we're learning more and more about how COVID-19 manifests in children. That being said, there is no indication that there is any correlation with vaccinations. I
want to speak for Julia, but I think the inference of the question was the other way. That is the absence of vaccination, is the fact that so many kids are not vaccinated who would have been otherwise. Is that potentially contributing to the emergence of MISC? So I'll go back to you and then again welcome in Dr. Varma or Dr. Katz if they want to add.
Yeah, there's no indication that there's any even remote connection. So, I want to make sure that the message comes across loud and clear.
Ed?
Nothing for me.
I think Dr. Barbeau did a good job.
All right. Go ahead.
Next, we have Rich from WCBS 880.
Mr. Mayor, just a quick question about schools. People I know in the education business all are very skeptical about reopening schools in September, just talking about transportation, talking about the spacing that you need between children in a school.
I think about what it takes to reopen schools. I am not thinking abstractly. I'm thinking very humanly, very grassroots. Yeah, it takes a lot to bring it together. And it's going to be a decision based on safety first and health first, unquestionably. But we gotta, I just gotta get people to pay attention to the calendar a little bit more. It's May 20th. We're talking about opening up schools in the second week of September. We don't know what the world's going to look like then. We're not going to do it. So, and that's about the safety of our kids, our parents, our educators, our school staff, everyone. So the things we talked about earlier, the way we would do testing on a much bigger scale, the way we would document testing the appropriate way, temperature checks, there's all sorts of methodologies that will allow us to bring anything back. And so we are planning on the goal of bringing back school fully. But, I will just say to you and all your colleagues, if you want to ask me the question, an educator who's telling me that online is achieving the same thing as kids in classrooms. So we'll balance it, but it'll always be about safety first.
Next, we have Marcia from CBS.
Mr. Mayor, how are you doing?
Good, Marcia. How about you?
I have two questions relating to the nursing home thing. First of all, the idea of having people taking care of at home is intriguing. I'm wondering who would pay for it. Would it involve city, state, federal funds? Would you have to?
Everyone was united, city and state. We were totally united that we had to save lives and that we had to keep our hospitals from being overwhelmed. The singular focus we all had was on what was going to save the most lives, and that's what we did for weeks and weeks and weeks. And as finally things have gotten better we've all been focused on increasing testing. We've all been focused on increasing the supply of PPEs, all the things that would protect people. So the focus needs to be, a lot of me wondered, our society has changed so much. And again, people used to be closer together, families used to stay closer together, extended families all under one roof, all sorts of things that honestly I think there's a lot to be said for. And now families live all over the metro area, all over the country, and then nursing homes became a bigger and bigger thing. And I don't think it's a great model. I just don't. I think it is necessary for some people. I get it. But if we could, look, I would put this in the same rubric as universal health care, Marcia. We need to come out of this and have a country that devotes itself to universal health care and have a country that devotes itself to our seniors living at home as long as they possibly can. And that should be federal support first, and of course the state has a role to play, but I certainly don't rule out the city playing a role if that's what's going to get the job done. But imagine what a better society it would be if seniors had the ability to stay at home longer. Imagine how much better their lives would be.
Lack of enforcement and oversight, which is state, DOH. So what can the city do? And my second question is, last week it was reported that the Rent Guidelines Board was going to be possibly reviving the vacancy bonus, and not just for vacant units, but also on occupied units. So I wanted to know what your
Jillian, I lost a few of your words. You said the Rent Guidelines Board and then...
Sorry. Yeah.
Say it again.
Yeah, they had revived the vacancy bonus.
If they've taken any final action on anything yet, because they're still, as I understand it, in their hearing process, et cetera. But let's get you that answer today. I certainly am concerned about that and want to figure that out. On the nursing homes, look, Jillian, I appreciate the question, and since it's WBAI, which is a station I have a lot of respect for and appreciate the role you've played in history, I think you will especially appreciate that the answer gets to the root of things. I think one of the big problems here is when it comes to taking care of, people who are so precious to us and are so vulnerable, is that something that's realistically going to work in a for-profit setting? Again, sometimes yes, but clearly sometimes no. So I am much more interested in a home-based system. I think it's much more humane. I think it's much more considerate of what most seniors want, maybe not all. And I know, home care workers, many of whom I've got, if it does, with what kind of additional regulation and restrictions, given everything we've learned here.
Next, we have Gersh from Streets Blog.
Hello, Mr. Mayor. How are you?
I'm good, Gersh. How you doing? Gersh, I have to say, you'll appreciate this. I'm missing softball, Gersh. I know you are too.
Oh, with the Prospect Park, those Saturday mornings are part of my memory. I miss you. I miss you in that respect as well, Mr. Mayor. Thank you for mentioning it. I do want to say, actually, on the topic of open space, you've got 20 miles question that we will allow ourselves to be invaded by cars because pollution and coronavirus is a dangerous cocktail.
That's a wonderful quote. So first of all, you have done your research accurately. I think the world of Anne Hidalgo. I think she's a fantastic leader. Of all the mayors in the world, she's one of the ones I admire the most, and I've spent a lot of time with her over the years. So I will certainly, I don't know what she has implemented in Paris, but I will look at it for sure, and I'll talk to her about it. Now, Gersh, you remember your history here as well. I want to see what we learn here for sure. I want to see what Paris is doing. You raised a great question, others did as well, about what this recovery needs to look like. And even though you and I joust sometimes, we have very strong common ground on a central issue. I want the recovery to involve people using their cars less in New York City. I'd like to see less car ownership in New York City. I'd like to see a lot more use of mass transit. And I think we have to do bold things to get there. That's different from what we're going to deal with. More and more reasons for people to not own a car in New York City. So we will look at any and all good models here and everywhere else as part of that planning. I want to see a fair recovery. And a fair recovery to me means more and more mass transit, fewer and fewer cars.
Last two for today. Next we have Juliet from 1010 Wins.
Oh, hi. Good morning, Mr. Mayor. How are you today?
I'm doing well, Juliet. Are you about to uncover another thing that we have to go correct?
Sent out in the food program. A resident from Astoria tells me the kosher deliveries were fine at first. Now he's getting packages with potato chips, a hollow roll with peanut butter and chocolate chip cookies, and it's the same package over and over. And another resident from Manhattan who gets non-kosher meals received the same chicken meal in 9 packages all in one delivery. So while they're very appreciative, they're wondering if there's any way to fix that.
Yeah. No, there absolutely is. Juliet, I'm going to keep thousands and thousands of our yellow cab drivers and green cab drivers and Uber drivers and everyone else who didn't have a lot of work and they signed up to do food deliveries directly to the homes of vulnerable people. Millions upon millions of meals being provided direct to home or through the school sites, 500 school sites operating now, providing 3 meals a day to anybody, everybody who needs them. I mean, there's a lot of success here and a lot of good people who deserve our thanks who have put this together. But we still see problems. And I'll ask our food, you shouldn't have some fun in life and some of that, but I'm hearing about too much of that. And so I want to make sure that our meals are nutritious and are balanced and that people are getting quality food. So I will get you a further answer, but I'm glad you're raising it and I'm glad everyone else did. That's certainly not the goal here, to give people food that's not going to make them healthy. And then on the yeshiva, so look, I think the community leaders have been outstanding. If you are doing something wrong, we'll go deal with them. If you have a name and a location, please give it to our team, Juliet, and we will deal with it right away. But from what I'm seeing, this is a rarity. But the best way, for the very few who are not getting the message, despite the fact that all their community leaders have said it time and time again, the best way to solve the problem is to shut them down. And if we need to use summonses, we'll use summonses. If we need to do a cease and desist order from the Department of Health, we'll do that. If we need to close the building, we'll do that. Whatever the heck it takes, we will do it.
Ago, but this is the second consecutive day that we've seen an increase in the number of COVID-related hospital admissions. And does this signify a hotspot in some area of the city? Is there a COVID Barry somewhere or a COVID Billy somewhere who's spreading this disease? Why is there some increase over these past few days? Why has it been so stubborn?
Yeah, going up by 6 people. So I would not agree to the way you're thinking about it. I think you're right to say, one, do we see a problem or a concern? Do we see a trend? No, I think we see the overall trends moving consistently. When you look at state indicators and city indicators, clearly everything is lining up for being able to do something very different in June, and that's fantastic. But this one, I don't see that.
Present 2 hospitals who have respiratory illnesses. Some of them will need to be admitted. Some of them may well be able to go home. As you've said so well, Mr. Mayor, the major gain was when this number dropped, and it dropped hugely so. And I think it's important that we keep watching it, but what we're watching is to make sure it doesn't go back up, that we don't have a large number of unexplained influenza-like illnesses. That would be very worrisome, and that would suggest that...
Doctor, want to jump in?
Mr. Mayor, I'll just add that as part of our ongoing surveillance as to how the virus is continuing to be transmitted, I think we have to take these indicators as a constellation. And to the degree that we're still having people test positive for COVID-19, it's to be expected that we will have a certain number of people, mainly because of chronic underlying illnesses, who will require hospitalization, individuals that have required hospitalization.
Excellent. Thank you. All right, everyone, as we conclude today, I want to take it back where I started and talk one more moment about our seniors. And this is the simplest message, which is remember the seniors in your life remember to connect with them, remember to check in on them, remember to ask them what help they need, and do all you can for them. You know, New Yorkers have done so much in this crisis, and so many of you, it's just more than ever now, because many seniors are feeling a lot of isolation right now, a lot of worry, and they need our help. The city's stepping up with things like the direct food delivery. Literally any senior who needs food delivered direct to their home, all they have to do is call 311 and they're going to get it for free. But I want that human touch too, where people remember, you know, even just a quick phone call, even a wave on the street, even just asking someone if they need you to run an errand. It really goes a long way. So we're going to do the big things that